everyone, welcome back to the life of T and M. Thank you so much for coming back and watching another one of my videos. If you're new here, hi, my name is Mary and I make videos all about nursing. If you are a return subscriber, thank you so much for coming back and watching another one of my videos. If you're new here, don't forget to hit that subscribe button and join the journey. So as you can see by the title of this video, we are going to be talking about public health nursing, but specifically a foster care nurse. So some of you may have known that there are nurses that work in the foster care system, and some of you may have never known that. If you were like me, I never knew anything like that existed, but it just goes to show you how many different areas you can work in as a public health nurse. So one of my first early videos that I talked about public health nursing, I'll link it right above my head. I did talk about all the areas that you could work in, but that does not cover nearly the amount of programs that there are. There's always new grants and new funding coming down potentially from the state or the federal government that may open up new programs based on a needs assessment that they've done. And then they open up different programs and they may or may not need a nurse. If they do, then they'll open up a spot usually for a public health nurse if it is in a community setting or a public health setting. So I did want to highlight foster care nursing because what they do day in and day out really does make a difference. So you're probably wondering, what does a foster care nurse do? So what I will start off with is that foster care nurses are a supporting team member, and they work in collaboration with the social worker who is ultimately responsible and the primary case manager for the child. So what the foster care nurses do is they bring in their expertise to assist the social worker to make sure that the child is meeting all of its needs in regards to medical, dental, developmental, and mental health care needs of the child. So the nurses are there to make sure that the children obtain the services that they need, such as getting a well child exam, getting a dental exam. If they have already some diagnoses when they come into the system, the nurses make sure that they are seen by those specialty doctors. And if there's any follow-up appointments from any of those visits, the nurses make sure that those children follow up, because in the system, a child may move from house to house to house, which is what they call placement. And when the child is moving from house to house, maybe the medical information was not passed to the new home. Maybe the new foster care home maybe didn't read up on the appointments, or the appointment was on the day of a move and there was just no way logistically that the child could make it. The nurse is there as that support to make sure that appointments are followed through. And if they're not, making sure that they get rescheduled, and ultimately that the child does go and follows through with all these appointments. So the nurses also help out with case care planning. They also help out with making appointments if the caregiver needs assistance, or the social worker. So sometimes it could be challenging for a caregiver or social worker to expedite a referral or get an appointment. And it seems as though when the nurses are on board, or they call the provider's office and they let them know, hey, you know, we have a foster kid, we really need to expedite this referral. Can you help us out? And usually we've already built that rapport with all of these tertiary care centers or primary care physicians. And so when they hear us calling and they know that we have a foster kid who this really needs to be expedited, most of the time they can get us in a little bit earlier or connect us with maybe another provider in the area that can get them in sooner. Sometimes these foster kids may not have had care in a long time, or maybe medical care has been taken care of, but there's just this one follow-up appointment that has not been completed. We are there as that expert in the field to help facilitate all of these referrals and all of these appointments, just to make the social worker's life a little bit easier. They do so much, there's so much going on, and if the nurses can really help with that aspect of the case, it really does help ultimately the child at the end of the day. Another aspect is interpreting medical records. You know, if you were just a layman's person and you're reading medical records, you may not understand what that means. You may not know medical jargon, and that's okay. You're not trained to know. And so the nurses will come in and actually review the reports, read it, and in layman's term, let the social worker know what this medical record is saying. And the nurse sometimes when they're going through the medical records, they may notice something like, hey, this kid is 5 years old and they only weigh this much, and this is what their developmental screening was. Did you pick up up on that? Did parents or foster parents say anything? And the social workers may say, hey, nobody told me anything, but the nurses are reviewing maybe past medical records or current medical records and like, hey, you know, they are delayed in their development. We need to make sure we get a referral to like a regional center or referral to OTPT, right? And so it's really nice to have a nurse review those records and catch anything so that these children don't fall through the cracks. They also help update. There is a medical chart, is like what we like to say. It's an electronic medical chart all about the health and development of the child. So the nurses will read the records and interpret that in there. And then this medical record gets to get passed on from caregiver to caregiver, and also make sure that the child knows, if they're old enough, what has their care been, what needs to follow up, are there any allergies, do they have maybe any ports or any pacemakers, are they on a feeding tube? And so it just gives a nice picture for whoever's taking care of the child of what has been going on medically. There's also a mental behavioral health aspect of that, where the nurses are reviewing medications, whether that be for like a medical diagnosis, vitamins, something for a diagnosis such as autism, ADHD, maybe they have cerebral palsy. And so there's a wide range of diagnoses that these kids could have when they come in. And so as the nurse, we are obtaining records, we're reviewing, and we're making sure everyone is informed. It is not every day that a kid comes into the system and we have all the history. We know everything and we know how to continue taking care of this child. And so sometimes the nurses are going through histories of records or may have nothing to go off of, so they're just getting them into a physician to get a physical and say, hey, let's see what's going on. So the nurses pretty much work in the background of these cases, is what I like to say. Like I said, that they're supporting the case. They are one of the interdisciplinary team members on the case, but they do a lot of work for these kids, making sure, like I said, all their needs are met all the way around, and keeping up to date with the latest evidence-based practice and really advocating for this population. Well guys, this is just a brief overview of what the nurses do in this specialty specifically. I can go into more detail. If you have more questions about this role, please let me know. You can DM me, I'll put my Instagram right here, or you can comment down below and I'll definitely reply to you all. If you guys like these kind of videos, I have a couple more specialties that I can talk about for public health nursing, but I know I get some questions from you guys of where else can you work as a public health nurse? When I look it up, I only see this specialty or this specialty. But like I said, there are so many different avenues that you can work in, and you just really have to find what you like and what you want to do. So if you are a foster care nurse out there, hats off to you. You guys are doing amazing work. And for all the nurses working everywhere, keep up the good work, and I will see you guys in my next video. Bye.